My name is Stephanie Guevara, and I'll be covering information regarding Rift Valley fever. I'll be talking about transmission, species that it affects, including humans, and other key points. What is Rift Valley fever? Rift Valley fever is a viral mosquito-borne virus that affects both humans and animals. It's commonly seen in domestic animals such as cattle, sheep, goats, camels, buffalo, and other ruminants. This disease causes fever, severe illness, abortions, and a high mortality rate. In humans, it causes flu-like symptoms. Outbreak. In 1997-1998 in Kenya, this was the largest outbreak reported. There is 89,000 human cases and 478 deaths. In 2006 and 2007 in Kenya, there were over 1,000 human cases and 300 deaths. In 2003 in Egypt, this was the first outbreak outside of Africa. There was 45 cases and 17 deaths. In 2010 in South Africa, there was over 14,000 animal cases. Transmission. There's different ways that you could get this virus. Sometimes by blood, bodily fluids, tissues of infected animal, bites from infected mosquitoes, or flies. This virus is zoonotic, so that means it can be transferred from animal to person, but there's no record that it can be transferred from person to person. Some ways that you could get it is by slaughter, consuming raw milk or uncooked meat, and also when you assist in delivering animals, if you don't wash your hands, you could also get the virus if that animal is infected, but you may never know. The way animals can get it, it's mainly by mosquitoes. So the way this happens is the mosquitoes lay their eggs in the dry rainforest. When it rains heavily, that means it gives the eggs proper environment to hatch. The newly hatched mosquitoes look for a feeding source, which makes the infected ruminant a proper host to spread the disease. So when they bite the infected host, and they could spread it from animal to different animals. This is the meat, how it looks when the animal is infected. Symptoms. In ruminants such as cattle, goats, and sheep, some of the symptoms are fever, weakness, anorexia, or diarrhea. In humans, it's fever, headache, and vomiting. Humans. The incubation period is from 2 to 6 days. They have an influenza-like illness, such as fever, headache, vomiting. The recovery days is from 2 to 7 days. Sometimes, but rarely, they have hemorrhagic fevers and encephalitis. Ovine and caprine. Incubation period for the adult ovine to caprines, it's less than 3 days. They experience fever, weakness, diarrhea, nasal discharge, and vomiting. They have a very high rate of abortions, and their death rate is from 20 to 30%. In kids and lambs, their incubation period is around 12 to 36 hours. After like 2 weeks, and they're still alive, then they're out of the dust. They're good. Cattle. In adult cattle, their abortion rate is up to 100%, so it's a very high rate. They experience fever, weakness, anorexia, and diarrhea. Their death rate, when they have this disease, is 10%. In calves, they experience the same symptoms as lambs and kids, and their death rate is from 10 to 70%. Diagnosis. Some ways you can diagnose this disease is by laboratory testing, which is from animal blood and tissue sample, and the antibody testing is called ELISA, which can confirm the virus as well. Treatment and prevention. So there is a vaccine, but it's not FDA approved. The CDC researchers have developed a vaccine that has been tested on animals that had this virus, but the FDA has not approved. So doctors aren't really using it. So this case is very common, and doctors usually prescribe antibiotics to treat this case. Prevention. Some ways humans can prevent this case is by using their PPE when they're around infected animals or infected areas that have tested positive for this virus. And some ways animals can be prevented is keeping up on vaccines, annual physicals, and pretty much trying to use bug spray and everything with animals and humans. And these are my sources, and thank you very much.